Hi everyone! In today's video, we're talking about breastfeeding, the natural and recommended way to feed and nourish infants. The American Academy of Pediatrics has laid out some compelling evidence for why breastfeeding is crucial for both infants and mothers. Let's dive into the facts. Did you know that breastfeeding provides unmatched nutrition and immune support for babies? According to the AAP, breastfeeding reduces the risk of sudden infant death syndrome by up to 64%. It also lowers the chance of your baby developing common illnesses like otitis media or ear infections by 43%, respiratory infections by 19%, and severe diarrhea by 30%. But that's not all. Breastfeeding can also reduce the risk of your child developing type 1 diabetes by 57% and obesity by 22%. Now that's impressive. Moms, the benefits don't stop at your baby. Breastfeeding can help you too. It lowers your risk of developing type 2 diabetes by 33%, breast cancer by up to 28%, and ovarian cancer by 30%. Breastfeeding for longer than 12 months also reduces the risk of hypertension and helps in weight management after childbirth. So, what's the recommended breastfeeding schedule? The AAP suggests exclusive breastfeeding for the first 6 months, meaning no other food or liquids, just breast milk. After that, continue breastfeeding while introducing complementary foods, and ideally, breastfeed for up to 2 years or beyond. Here's an important stat to know. In the United States, 83.9% of mothers initiate breastfeeding, but only 25.8% are still exclusively breastfeeding at 6 months. This is lower than the Healthy People 2030 goal of 42.4%. Disparities also exist. Non-Hispanic Black mothers have significantly lower breastfeeding rates, at 74%, compared to their white and Hispanic counterparts, highlighting the need for more support in certain communities. While breastfeeding is incredibly beneficial, there are a few rare cases where it's contraindicated: classic galactosemia, an infant metabolic disorder; untreated HIV due to the risk of transmission; illicit drug use, substances like cocaine and PCP are harmful to the baby; active herpes lesions on the breast. Breastfeeding should be avoided from the affected breast until healed; other infectious diseases such as untreated brucellosis or Ebola. However, most other infections like hepatitis B and C are not contraindications, and breastfeeding can continue with proper precautions. Now let's address 2 common questions. Question 1, is it safe to take medications while breastfeeding? Yes, most medications are safe to use while breastfeeding. In fact, many healthcare providers refer to LactMed, a trusted resource, to check if specific medications are safe. Always consult your doctor before stopping or starting any new medication. Question 2, can I breastfeed if I've had COVID-19? Yes. Current evidence suggests that breast milk provides protective antibodies to your baby. If you're sick, it's recommended to wear a mask and wash your hands before feeding to minimize respiratory transmission. To sum it all up, breastfeeding is one of the most powerful ways to protect both your baby's health and your own. It's natural, full of benefits, and supported by healthcare providers worldwide. If you're able to breastfeed, the AAP encourages you to try for at least 6 months exclusively and for 2 years or longer with complementary foods. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. See you in the next video.